With Southwest Suburban Immigrant Project SSIP. I will be your MC for this evening. Thank you all for joining us for this event. SSIP is a proud member of the Illinois Coalition for Immigrant Refugee Rights. Together, along with many other ICIRR members, we have worked to advance rights through the state of Illinois. Some of our recent victories include the closing of all detention centers, child tax credit for immigrant families, and hospital screening for uninsured patients. Today, we are here to share health resources that are available for those individuals that recently lost their health coverage they had through the health benefits for immigrant adults, HBIA, and thousands who continue being uninsured. I'd like to start off by thanking our partners who have helped us put this event together. A special shout out to Shriver Center on Poverty Law, Cook County Health, and Mano for being with us today. And thanks to ICIRR for hosting us this evening. Let's begin by discussing how we got to this change. In 2021, the HBIA program was created for people between the age of 54 to 64 years old. And the following year, it was expanded for people who were 42 to 53 years old. This past February, no funding was allocated for the program. And despite our collective advocacy during the state legislative session, we were not able to change this. As a result, the Illinois Department of Healthcare and Family Services, HFS, began sending notice to HBIA clients that they would lose their medical coverage as of June 30, 2025. This means that over 30,000 people lost their coverage and now are uninsured. We know this is a huge loss for many, and despite not having health insurance anymore, they still need health access. We also want to make people aware that if you were on HBIA and turned 65 years older before July 1st, 2025, you should have been transitioned to the program HBIS. If you were not, please contact ICIRR's hotline at 1-855-435-7693. Now, I'm going to talk briefly about the HBIS program. For now, the HBIS program remains open for those already enrolled. They are not accepting new applications. It is very important that people enrolled in HBIS continue renewing their coverage. HFS will send redetermination notices as you get close to the date of when you first applied. If you do not submit your redetermination notice, you may still have time. You have 90 days from the deadline to take action. You can call HFS, and the phone number is 1-877-805-5312 for free from Monday through Friday, 7:45 to 4:30. It is really important to complete that redetermination for the HBIS program. Now let's start a program for this event. As we get the program started, feel free to drop any of your questions in the comments. Let's learn about the CareLink program offered at Cook County Health. Welcome, Cindy San Miguel. Welcome, Cindy.
Hi, thank you so much. As mentioned, my name is Cindy San Miguel and I work at Cook County Health. I'm going to tell you a little bit about the CareLink financial program. So what this program does, it helps residents of Cook County cover any cost of treatment at any Cook County Health facility. So CareLink is specifically designed to assist uninsured or underinsured patients and cover the cost of any services received at Cook County Health. So this can include clinic visits, lab tests, hospital stays, urgent or emergency visits. So I have the website here so that you all can take a picture or note it. And we also have a phone number that you can call if you're interested in applying. That is 866-223-2817. And we will show this again in a moment. All right. So what does this mean specifically for members that were part of HBIA? If an HBIA member lives in Cook County, they're eligible for CareLink. If you are a Cook County Health patient already and a county care member that was part of HBIA, you are automatically enrolled in CareLink. If you're not a Cook County Health patient yet, or you were not a county care member, meaning you were part of one of the other Medicaid health plans like Blue Cross Blue Shield, Meridian, Aetna, or Molina, you can complete an application to be part of CareLink with one of our financial counselors. So HBIA members will have what we call presumptive eligibility, meaning that you're already eligible for the CareLink program, and you won't need to provide any additional documentation to prove eligibility. So HBIA members will be approved for CareLink for up to 12 months. At this point, at the end of that period, you will be asked to renew coverage. And we want to make sure that it's super clear that immigration status is not a factor in determining eligibility. So what is covered by CareLink? I started to mention that a little bit. CareLink covers medical visits, hospital stays, family planning like birth control, laboratory tests, x-rays. We do have a couple of other services that are covered, such as dental services as well, but they're very specific dental services. So if you call and you're enrolled in the program, they can explain that in a little bit further detail. You might have to have a copay for prescriptions, but the max that you'd be charged per prescription for a total pharmacy visit would be $20. So they're typically $4 per prescription for a maximum of $20 for pharmacy. And so as part of a CareLink member, you would get care coordination services, and you'd also get an identification card that you could take with you to your different appointments. So how do you meet with a financial counselor? We have financial counselors at almost all of our locations. But you can also visit our website at cookcountyhealth.org/carelink. You could to get details on how to schedule that visit. But you can also call this phone number, 866-223-2817. And we're available Monday to Friday, 8 a.m. to 6 p.m. or Saturdays, 8 a.m. to 4 p.m. And we have representatives that can help support you in your preferred language. So we just wanted to make sure that you could see this map so you can see that we're all over Cook County. So we have clinic sites in the suburbs such as Arlington Heights, Blue Island, some clinic in Cottage Grove, but we have several sites also within the Chicago city limits such as Austin. We have a clinic, Jorge Prieto, in Little Village. We have clinics down in Inglewood, Bronzeville as well. We have a new clinic also in Belmont Cragen. So we have lots of sites that you can come and find one of our financial counselors.
Thank you so much, Cindy, for sharing this information with us. Now we will hear from Andrea Kobeck, attorney at the Shriver Center for Poverty Law, who will talk to us about health resources for everyone. Welcome, Andrea.
Thank you. So first, under the federal law called Emergency Medical Treatment and Active Labor Act, or EMTALA, if a patient has an emergency, the hospital must treat that condition to the best of its ability or transfer the patient to another hospital with adequate capabilities. Under the Illinois Constitution, all tax-exempt or nonprofit hospitals in Illinois have a legal obligation to provide financial assistance for all low-income, uninsured patients. Hospitals are required to provide this assistance because the hospitals do not pay property taxes. Public and nonprofit hospitals must provide free or low-cost care to low-income, uninsured patients living in Illinois. In order to qualify, your family income must be under certain limits. 200%, so up to 200% of the federal poverty level in urban areas, and 125% of the federal poverty level for rural or critical access hospitals. There are no immigration status requirements to qualify, and they may apply for financial assistance prior to treatment for hospital services that are not immediate emergencies. Eligible individuals are uninsured individuals. Individuals must be living in Illinois, be an Illinois resident. You cannot be a tourist, a person on a tourist visa, for instance, they would not qualify. Low income, so that again means individuals with up to 200% of the federal poverty level for income, which in 2025, a family of 4 with less than $64,300 annual income qualified. There are several requirements to receive hospital financial assistance that require proof of income, identity, and living in the state of Illinois. Remember, there are organizations that can help you apply for this assistance and other benefits as well. You can call ICIRR's Family Support Network line at 1-855-435-7693 to be connected to the organization that is closest to you. Now, let's talk about community clinics such as Erie or Access and many more. Community health clinics are not-for-profit, community-owned and operated clinics. They provide care to the uninsured, and they serve people regardless of immigration status. People must be low income. Now, please note that just today, the federal government released a new notice that may result in clinics making some changes in the future. And we'll learn more about those changes in the next few weeks, about how these changes may impact patients. But for now, clinics and healthcare centers are still a vital, accessible resource. They provide a variety of services, including primary medical care, laboratory services, and specialty care programs and services. They may even include mental health and prenatal care. To find the community clinic nearest you, visit www.findahealthcenter.hrsa.gov, or you can also call the Family Support Network at 855 435 7693. Choose your preferred language and press 5 for health. Someone will return your call within 24 to 48 hours. Now let's talk about free and charitable clinics. There are approximately 45 free or charitable clinics in the state. Some examples are Community Health and Will Grundy Medical Clinics. The purpose of free and charitable clinics is to provide basic medical services to uninsured residents. Most physicians and other providers who see patients at these clinics are volunteers. Availability of services varies by region. To locate a free clinic, go to www.illinoisfreeclinics.org/clinic-search/. Now, let's talk about a program for uninsured people living in DuPage County. It's called Access DuPage. Access DuPage is not health insurance, but it coordinates low-cost comprehensive health care, including primary and specialty care and hospital services, with the help of community partners and volunteers. To qualify for Access DuPage, you must live in DuPage County, meet their income guidelines, which is up to 250% of the poverty level, and provide proof of living in DuPage County. An example of up to 250% of the poverty level for a family of 3 is up to $66,625 for yearly annual income. If you'd like to see if you qualify or to fill out an application, call 630-510-8720, extension 204. And again, that's for Access DuPage. Another program that provides health care services is Access to Care. Access to Care is a nonprofit health program for residents of suburban Cook County and Northwest Chicago who have low incomes up to 300% of the federal poverty level. An example of that for a family of 3 is up to $79,950 a year. To qualify for Access to Care program, you must live in the Northwest Chicago area or Cook County suburbs, have no health insurance, or you are insured but you have high deductibles of $1,500 or more, and you also must not be eligible for public health insurance such as Medicaid. To apply or see if you're eligible for the Access to Care program, call 708-531-0680.
Thank you, Andrea, for sharing all these resources with us. We're ready to pass this information along to our families, neighbors, and friends. Now to our audience tonight. It's your turn to ask Andrea and Cindy your questions. Please drop your questions about the resources available for people without health insurance in the comments, and we'll answer as many as we can in the next few moments. If you guys want to drop the questions in the chat, I do see a couple. Let's start with the first one. Andrea, the question is, are these options to apply online or only in person?
So for Access to Page and Access to Care, you can call the phone numbers that were listed on the previous slides, or there's information on their websites as well. So you do not have to apply in person. For free and charitable clinics and the other health care centers that I mentioned, it's best to call them over the phone and see if they're taking new patients.
Perfect. Thank you, Andrea. We have another question. What's the process to apply for emergency Medicaid, and how long does it take to get approved for emergency Medicaid?
So you can apply online through ABE, the application for benefits portal for emergency Medicaid, and there's actually a checkbox that indicates that you're only applying for emergency Medicaid if you are in the hospital in the emergency room, and you can indicate to your healthcare provider that you would be interested in applying for emergency Medicaid, and the healthcare provider can um, help you apply for the emergency Medicaid. So those are two ways.
Perfect. Thank you, Andrea, for answering that question. We have another question. Are there any resources available for immigrants who have no health insurance in Kane County?
So this would be an instance where it would be helpful to use one of the ICIRR hotline numbers, to call the ICIRR hotline number and ask if there are resources in King County, or you could go to the website that was put up in a previous slide that listed the HRSA healthcare centers. Because if you go to that website, you can actually search by county or by city that you live in to see where the nearest healthcare center is. And then once you find, oh, thank you. And then once you find the healthcare center, you can call them and ask if they're accepting new patients.
Perfect. Thank you for answering that, Andrea. The next question is, could I have information for clients from Cicero and Berwyn? Thanks.
So that would be Cook County. Do you want to talk? Thanks, Cindy.
Yeah, sure thing. So one of the options that's available is for individuals that live in Cicero Berwyn is to apply for CareLink. So as mentioned, if they are HBIA members, they have that presumptive eligibility, meaning that they're already eligible for that program, and they won't have to provide additional documentation to show that they meet the financial requirements. So given that location, I think one of the best clinics to visit would be our clinic in Riverside. We do have a site there. So we can, I'll find the number really quickly on my slide deck. You can call 866 223 2817 in order to connect with someone at Cook County Health and make an appointment over at our Riverside Clinic in order for that person to be able to apply for CareLink. The other options that were also mentioned by Andrea are something else that your clients can pursue. And Andrea, do you want to talk about some of the options that you talked about, like the free and charitable clinics?
Yes, you can go on the website that was provided earlier for how to find a free and charitable clinic and look by zip code or by city. And same with the website that was put up just a minute ago, the HRSA website. You can also look that way as well.
Perfect. Thank you for answering the question, both of you. We have another question. It says, hello, do you have any healthcare agencies to apply in King County, Aurora area?
So I think the best bet, again, to find a primary care doctor or is to use one of the free and charitable clinics or find a healthcenter.hrsa.gov and then put in your zip code or put in your city to find the closest center. And then again, make yourself a list and then go through the list and just call and see if they're accepting new patients.
Perfect. Thank you, Andrea, for answering that question. We have another question. What age do you have to be to qualify for CareLink?
So to qualify for CareLink, you have to be 19 to 64 years old. If you are an individual that's below 19 years old, the best bet would be to apply for Medicaid if you are at the right income level. that would be the most comprehensive coverage and allow you to be able to receive care at multiple sites, not only at Cook County Health. So we would recommend anyone below the age of 19 to pursue a Medicaid application.
Perfect. Thank you for answering that, Cindy. We have another question. It says, if someone has Medicare with a high deductible, can they qualify for assistance?
I can they would they be able to qualify for CareLink? I think, for the programs that I mentioned earlier, like access to care that is open to people with high deductibles, I would suggest calling, because I'm not sure if they might be able to qualify, but I don't know all the details about that. So that's access to care, again, is for people who live in the suburbs of Cook County or northern Chicago. Cindy, do you have anything to add?
Yeah, I would give the same recommendation to call, and once you connect with someone with a financial counselor, to ask that question directly.
Perfect. Thank you, Andrea and Cindy, for answering that question. We have another question in the chat. When children turn 18 and they're no longer eligible for all kids, what's next?
So, depending on their immigration status, they may qualify for other options that the state of Illinois has, but they're very particular options. So, for instance, if they're part of a family that has applied for asylum, or they've applied for a trafficking visa, a T visa, or they've applied for a U visa, which is for victims of certain crimes, they would be eligible for state insurance that they can apply for through ABE, the application for benefits eligibility portal. Also, for people age 19 and older, there is a program in Illinois that provides comprehensive reproductive health services, including screenings and annual visits. It's called the Family Planning Presumptive Eligibility Program. It's a temporary program that does provide some services. And again, people can apply through ABE for that as well. And for health insurance, as someone ages, if at any point they become pregnant, they would be eligible for the Moms and Babies program, which is for pregnant people or recently pregnant people with income up to 213% of the poverty level, and that's available regardless of immigration status. If the person doesn't qualify for any of those insurance programs, then their best bet is to look at one of the resources that we've already talked about, where they can still connect with a primary care home through Access to Page or through Access to Care or through CareLink.
Perfect. Thank you, Andrea, for answering that question. We have one more question. Let me see if anybody has any additional questions. Let's see. Which hospitals do not pay taxes? So I know where to go for an emergency. Andrea, if you can answer that question.
So you should go to your nearest hospital if you're having an emergency. Every hospital that has an emergency room is bound by that EMTALA federal law to see you, and that if you are low income and uninsured and don't qualify for Medicaid due to your immigration status, then you'll qualify for emergency Medicaid. So you shouldn't receive a bill for those services if they're qualifying emergency services. So that's the best way to answer that.
Perfect. Thank you, Andrea. Thank you for all your questions. If we weren't able to answer your questions during the live, we'll do our best to respond in the comments. A big thank you to Cindy and Andrea for sharing such important information and for answering any questions that you guys had. Now let's review our health rights because even though we're going through some major transitions, we still have general rights to access healthcare no matter our immigration or insurance status. So health know your rights. So you have the right to receive care at a hospital without discrimination based on your immigration status, language, health insurance, or religion. No hospital staff member, including doctors, is allowed to ask you about your immigration status or your country of origin. You have the right to interpretation and translation services. This can be provided in person, by phone, or by video. You have the right to be screened for financial assistance if you do not have health insurance. Even if you do have health insurance but still can't afford to pay, you can also request to be evaluated for financial assistance and healthcare coverage options. You can use these programs without worrying about public charge. They do not count against you. They do not affect the person applying or their family members, and they do not affect your immigration status or pending immigration application you may have. If you feel that your health rights were not respected, or if you have any questions or concerns about your experience at a health center, please call the Family Support Hotline at 1-855-435-7693 to connect with ICIRR staff. For health access, press 5 and follow the instructions. Thank you. The ICIR's Family Support Network is 1-855-435-7693, and you would follow the prompts and press 5 for health care access. Okay. So we have to stand up for our rights because that is the only way we can change the healthcare system. Before closing, we want to inform you that that the Family Support Line has a new option to report problems related to public benefits and translation and interpretation services. For this new option, press 6 in the main menu. So if you have any questions, please call ICIR's Family Support Line. Thank you so much for joining us tonight. Also, thanks for our experts today for their support and wisdom. Remember that this program is recorded and you can come back to watch and share it. We are still in the fight. Good night. Thank you, everyone, for joining us today.